Hello, today our topic of discussion is temporomandibular joint. The temporomandibular joint is a biarthroidal hinge joint that facilitates the complex movements necessary for eating, swallowing, speaking and yawning, etc. It is located anteriorly to the ear tragus on the lateral aspect of face. The temporomandibular joints are two joints connecting the jawbone to skull. It is bilateral synovial articulation between temporal bone of the cranium above and the mandible below. To be very specific, the joint surfaces include the mandibular fossa and articular tubercle from the temporal bone and the head or condylar process of the ramus of mandible. It is unique in a sense that two joints function as a single unit to produce movements of the lower jaw. Coming to the anatomy of the joint, the articular surfaces are covered by fibrocartilage and are separated by an intra-articular disc, which separates the joint cavity into two compartments that are lined by synovial membrane. So, the intra-articular disc, it separates the joint cavity into two compartments. The joint is covered by a joint capsule. The three important extracapsular ligaments associated with this joint are the lateral temporomandibular ligament, the sphenomandibular ligament, and the stylomandibular ligament. There are short capsular fibers that extends from temporal bone to the interarticular disc and from the disc to condyle of the mandible. Then there are longer capsular fibers which extend from the temporal bone to the condyle of the mandible and can be considered as reinforcing fibers. However, true capsular fibers passing between the temporal bone and the mandible are present only on the lateral side of the joint. The lateral temporomandibular ligament is a lateral thickening of the joint capsule. It runs from the articular tubercle of the temporal bone above to the lateral surface and border of the neck of mandible below. It functions to prevent posterior dislocation of the joint. The stylomandibular ligament runs from the apex of the styloid process to the angle of the mandible and the adjoining posterior border of the mandible. It has no functional significance but separates the infratemporal region anteriorly from the parotid region posteriorly and thus can be considered as an accessory ligament. Now coming to the sphenomandibular ligament, it runs from the spine of the sphenoid bone to the lingula of the mandible, which is this triangular bony projection overlapping the mandibular foramen. The relations of the sphenomandibular ligament are that the superlateral to it are lateral pterygoid muscle and auriculotemporal nerve. Inferiorly are the maxillary vessels. Inframedial to it is the medial pterygoid muscle. The mylohyoid nerve and vessel pierce this sphenomandibular ligament. It is separated from the pharynx by the pharyngeal vein and fat, while in its upper part it is crossed by chorda tympani nerve. The inferior alveolar nerve passes between sphenomandibular ligament and the ramus of the mandible to gain access to mandibular foramen. This ligament is a remnant of the embryonic lower jaw, which is Meckel's cartilage. Other accessory ligaments include those which connect the mandible and the middle ear. These automandibular ligaments include discomalleolar ligament and malleomandibular ligament. Coming to the nerve supply of this temporomandibular joint is by auriculotemporal nerve and mesenteric nerve, which are branches of the mandibular division of trigeminal or fifth cranial nerve. The blood supply of temporomandibular joint is primarily by the branches of the external carotid artery, predominantly the superficial temporal branch. The other branches of the external carotid artery, namely the deep auricular artery, anterior tympanic artery, ascending pharyngeal artery, and maxillary artery, may also contribute to the arterial blood supply of the joint. Thus, we can say that the blood supply of temporomandibular joint is by superficial temporal artery and the maxillary artery. Here it should also be noted that the fibrocartilage that overlays the condyle of the mandible is avascular. Now coming to the development of the temporomandibular joint. The development of the TM joint occurs at around 12 weeks when the joint spaces and the articular disc develop. At approximately 10 weeks, the component of the fetus future joint becomes evident in the mesenchyme between condylar cartilage of the mandible and the developing temporal bone. Two slit-like joint cavities and intervening disc make their appearance in this region by 12 weeks. The mesenchyme around the joint begins to form the fibrous joint capsule. Little is known about the significance of newly formed muscles in the joint formation. The developing superior head of the lateral thyroid muscle attaches to the anterior portion of the fetal disc. The disc also continues posteriorly through the petrotympanic fissure and attaches to the malleus of the middle ear, thereby giving rise to the primitive otomandibular ligaments. A growth center is located in the head of each mandibular condyle before an individual reaches maturity. This growth center consists of hyaline cartilage underneath the periosteum on the articular surfaces of the condyle. This is the last growth center of the bone in the body and is multidirectional in its growth capacity, unlike a typical long bone. This area of the cartilage within the bone grows in length by appositional growth as an individual grows to maturity. Over time, the cartilage is replaced by bone using enchondral ossification. This mandibular growth center in the condyle allows the increased length of the mandible needed for the larger permanent teeth as well as for the larger brain capacity of the adult. This growth of the mandible also influences the overall shape of the face. This was all about temporomandibular joint. The disorders of the TM joint as well as the muscles producing movement at TM joint, which are the primary muscles of mastication and the accessory muscles of mastication, they have all been discussed in the previous video of the mandible. Thanks for watching the video. Don't forget to subscribe and share.